the talk, inshallah, tonight. Please stick around. And if we can have Dr. Imad and Dr. Hassan come up, please. Jazakumullah khair. Okay, inshallah, we'll get started. Assalamu alaikum wa rahmatullahi wa barakatuh. I don't think you're paying attention. Assalamu alaikum wa rahmatullahi wa barakatuh. MashaAllah, there we go. Jazakumullah khair for joining us. Tonight is our monthly Healthy Living series. Today we have two very important experts in our community, mashallah. This is a very important topic that we're going to be talking about. So, without further ado, we'll get started. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على سيد المرسلين محمد وعلى آله وصحبه أجمعين أما بعد. So today we have Dr. Hassan Almoazen that you all know and Dr. Imad Omer as well. Dr. Hassan is a professor of pharmaceutical sciences at the University of Tennessee Health Science Center in Midtown at the College of Pharmacy. And Dr. Imad Omer is a practicing board-certified infectious disease specialist with the Threlkel group at the Baptist Hospital at Baptist Memphis, and he's been practicing for over 20 years, mashallah. He was part of the committee that also helped us with our COVID guidelines during the COVID pandemic. The topic we're going to be talking about is a topic of high importance. We're going to talk about what are vaccines and what is important about vaccines and dispel some of the myths going around about vaccines. As you know, in the current climate, there's a lot of misinformation on social media and in official circles about what are vaccines and what is the safety about vaccines. There's a lot of misinformation in our community, our Muslim community, and a lot of hesitancy about vaccination as well, for various reasons beyond the scope of this talk. But it's important to know what the facts are, and who better to get the facts from than the experts, mashallah. So we'll get it to Dr. Hassan first.
Assalamu alaikum wa rahmatullahi wa barakatuh. I mean, yesterday I was sitting on the other side. Today I'm on the podium side. It's a pleasure for me, inshallah, to share this talk with my brother, Dr. Imad. Vaccines, as you know, is an important topic, particularly in combating disease and infection. So today we're going to give you an overview on how vaccines work. And then we're going to talk about 4 different vaccines. So I'm going to start by talking about generality of vaccines, how to use them. Then I will shift to Dr. Imad to talk about the diseases. So I'll give you an outline. So we'll talk about the types of vaccines. We'll talk about the immune system. We'll talk about how do vaccines work. Then I've listed four vaccines that typically we're going to discuss today. So typically, if you look at in this slide, we have summary of all the vaccines that you expect to see right now in market in the United States. The first type of vaccine that you see here is called live attenuated vaccine. This comes from a virus, a regular virus that has been weakened by treatment through chemicals. So the chemicals will weaken that vaccine so it cannot induce or cause a disease, but can induce an immune response in the body. The next one next to it is an inactivated vaccine that has been completely inactivated, so it cannot cause a disease, but can also induce an immune response. The one next to it, this has what's called the toxins of the virus. These are specialized proteins that the virus excrete when it enters the body. So in this case, we don't have a virus. We have the materials that the virus excretes when it enters the body. These materials can induce immune response in the body, and we use them as a vaccine. And then we have, I see it here, the subunit vaccine, where we use a part of the vaccine. Can I use this one? Let's see if I can use this. All right. So with this type of vaccine, all right, we use part of the vaccine. So with this type of vaccine, we're not using a virus. We are using part of the virus. This part could be a protein on the surface of the virus, and we use that protein from the virus to induce the immune response. Then in this scheme that you see, this is called an mRNA vaccine. This was developed a few years ago when we had COVID. An mRNA where we use some synthesized in the lab, some genetic information. Once it enters the body, it begins to create a protein specific to a virus. And this is what the COVID vaccine was used when introduced in the market a few years ago. And then the one next to it is the recombinant virus, where we use DNA, genetic information, that can enter the body and begin to make RNA, then make a protein, and then the protein is very similar to the protein of the virus, and then we create an immune response. So the summary here, we're either using a dead virus, we're using a weak virus, we're using part of a virus, or we use the genetic information from the virus to make or generate an immune response in the body. This slide summarizes the immune system in the human body. So the immunity basically starts with the bone marrow and what's called the thymus. Thymus is a gland that sits close to the lungs. These two are the factory of making the typical immune cells that the body uses to fight pathogens like bacteria and viruses. There are what's called secondary organs that also produces immune cells. If you look at the immune cells, you will be amazed to see how many different specialized cells that Allah subhanahu wa ta'ala granted us to fight diseases. Each type of cell has a unique function. We want to focus on two kinds of cells, what's called T cells and B cells. These are the cells that generate what's called the antibodies that you see here. This is antibodies or cytokines that can also fight bacteria and viruses. So these B and T cells, they are responsible for making what's called the antibodies that will bind to the virus. And once they bind to the virus, it prevents the virus from going into the living cell, and the virus that cannot go to a living cell will not be able to generate more viruses. So we're killing the cycle, the life cycle of the virus. And then the T cell will pick up the virus with the antibody generated and will try to remove it outside the body. So typically when bacteria or a virus hits the body, immediately the first line of cells that we've seen here, the macrophages and other cells, begin to attack. And then in the next level, you have the B cells, T cells begin to secrete the antibodies that bind to the virus, and then the removal process begins. After clearing the virus from the body, then we have level 3 where we have T cells, B cells that can recognize the virus if it comes back. So these are the guards that protect the body in case in the future virus comes back. So you will have no disease or very minor disease. So I think now I want to shift to Dr. Imad to talk about the diseases, and then we'll continue on the vaccines.
Okay. Jazakallah khair. Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. Thanks to Sean for setting this up. And normally, if somebody asks me to give a talk for 2 hours, I can be prepared in like an hour, maybe 30 minutes. But giving a 20-minute talk on vaccines, that takes like a month to prepare. So it's not so easy sometimes. I'm going to talk about the sort of the disease part, and Dr. Hassan has done a good job. I hope you guys are ready for the test because he's a real professor. So he will ask you tough questions. So I'm going to just talk about some vaccine basics. He's already covered some of that, so we may go over it really fast. And then we'll talk about, prevention, the sort of diseases that are prevented by vaccines. And then I'm going to talk a little bit about measles because we've had a lot of outbreak of measles in the country. And there's been some sort of misinformation about the vaccine, et cetera. So I want to talk a little bit about that. And then we'll talk a little bit about the illnesses that are prevalent right now in the fall and the winter time that are important to get vaccinated for. And then if we have time, we can talk about some common, sort of vaccine questions and misperceptions. So I'm not going to spend too much time on this, but let me simplify vaccines. Dr. Hassan has given you the science. So I'm going to make it simple, like I tell my patients. Basically, vaccines trick the body into responding the way they would for a disease, right? So the goal is that the body does not become sick, but it fights as if it's fighting the disease. Basically, that's what vaccines do. And so all these different kinds of vaccines that Dr. Hassan went over, they are either a weakened illness, a bacteria or virus, or they are part of it, or that kind of thing, and it tricks the body into thinking that it needs to respond against a disease. This is a very simple way to think about it. The new thing is the mRNA vaccine, and that is a lot of misperceptions about that. People sometimes have a hard time understanding what that is. How many people, there's a lot of people I see in here that are doctors or have science backgrounds. Who really understands these mRNA vaccines? Nobody's raising their hand. Sean, you understand mRNA vaccines, right? All right, so mRNA vaccine is kind of like this. A regular vaccine is I come over to Brother Ali's house and I cook the biryani. Okay? The mRNA vaccine is I give him very specific instructions and give him the recipe, and he cooks the biryani. That's the difference. Okay? Does that make sense? Does that make sense?
Yes.
Yeah. Okay. All right. So that's all I'm going to say about vaccines. I think he's done a good job of explaining that. Okay. Next slide. So there are a number of illnesses, and this slide is not all inclusive, that are vaccine preventable diseases. And alhamdulillah, we live in an age where many of these vaccines are so successful that we have forgotten what these diseases are like. So some of us remember these diseases from our childhood or from long ago. When I was doing my medical training, we had a disease called Haemophilus influenza. It's a terrible disease for babies and children. They would get meningitis. They would get something called epiglottitis. They would end up on a ventilator sometimes. Many babies died from that. This is an illness that is almost unknown now because of how effective the vaccine is. Sean, have you seen a case of Haemophilus in a baby? Yeah, you probably never saw a case. So when I was doing my internship, this was a big concern in the hospitals, and now we don't see that illness. So there are a number of things here that we've been very successful at, and so vaccines work, and we'll talk about later why do we need to continue using vaccines when these diseases become so infrequent, because that's a question that many people have. Okay, next slide. So this slide sort of indicates, how successful we have been in terms of different illnesses in the United States, right? So you'll first see on there measles, which was very common. Measles is a very, very contagious illness. I'm going to give you a story about that in a minute. But in the pre-vaccine era, there were probably 3,000 cases per million in the United States. And after that, that disease dropped more than 99%. Until recently, when people sort of forgot about it and have, maybe as a consequence of some misinformation or maybe fatigue from vaccines, stopped vaccinating their children. And now we've seen outbreaks. Actually, in 2020, we had sort of declared that we've eradicated measles, but this year we've had almost 2,000 cases, right? So these illnesses can be well treated. Mumps, rubella. And the rubella is an illness that affects children, but more importantly can affect moms, and they can pass it to their babies, and it can cause a dreadful illness. So it's very important to vaccinate against these things. And you can see from this slide how successful these things are, and why they're important. And we'll talk again more about their importance. But I think one of the things sometimes people think, and this was true during the COVID era, and people think, well, you get the vaccine, but sometimes you still get the illness. And I didn't think that was supposed to happen. That's always been true. That's always been true with the vaccines, that some people will get the illness even though they've been vaccinated. But the idea is they don't become as sick. And there are very few diseases that we have actually completely eliminated. But I'm going to show you a slide. This one is a little bit kind of graphic. But next slide. This is two children, two boys. This is a very famous slide. This is from the year 1900. These two boys were in the same classroom, and they were exposed at the same time to somebody with smallpox. Now, the boy on the left who looks healthy, he has smallpox also. He has a few small lesions, and he was vaccinated. And the boy on the right, he wasn't vaccinated. And this disease, smallpox, just in the 20th century killed over 300 million people. Over 300 million people. So the disease was declared officially gone, eradicated from the world in 1979. The last case was actually in Mali, was a Muslim, but we don't have this disease anymore because the vaccine was so effective, and now we don't have to get vaccinated against smallpox. Some of us remember still getting vaccinated. I know Brother Bob got vaccinated for smallpox, so did I as a child, right? But we don't have the disease anymore. And there are a few diseases that we might be able to eradicate. Next slide. So just then to talk about measles again. So measles in the United States, there were a lot of cases. This disease is so contagious. I'll tell you an interesting story. There's a person that works for the health department. His name is Mike Osterholm, and he works for the Department of Health in Minnesota. He tells a very interesting story about measles. This gives you an idea of how contagious it is. So there was an outbreak of measles in Mexico City. A bunch of people got measles, maybe a group of like 100 people. And they were trying to figure out, well, where did this come from? All these people had attended a baseball game. So, okay, easy. We figured it out. They're all sitting together in one area of the stands, and they all had measles. So they started investigating, but all these people got sick about the same time. It wasn't clear who spread it to them. The person that actually got sick first was a player. He was standing at home plate, and 300 yards away, these people were sitting in the center field, and when they took a smoke stream, they saw that the smoke went to that area of the stands and infected, 200 people in that one spot. So measles is very contagious, and it spreads through the air like that and by contact. So it is very important for people to get the measles vaccine, the MMR, because even if there's just a few people that aren't vaccinated, you can get an outbreak, right? All right, next slide. All right, so this sort of discusses the, I can't see this too well. So there have been recent outbreaks, and as of November 4th, there were 1,681 confirmed measles cases. These are confirmed cases. There's more than that aren't actually confirmed. And there have been 44 outbreaks this year. And 87% of these confirmed cases are, associated with outbreaks. They're not just sporadic cases that you're seeing. These are, communities where many people got infected because there weren't enough people that were vaccinated. 12% of those cases had to be hospitalized, and there have been 3 deaths from measles. This is a sad thing because many years we have very few measles cases because the vaccination rate is pretty high. And so this is the reason that diseases that we don't see very often, you need to still vaccinate for, because we might vaccinate for them in the United States, but in other places in the world, they don't have the vaccine. It's just one plane ride away. When somebody gets here, they can spread it, and they can spread in a community, and the next community, and the next community, if people aren't vaccinated. So these diseases are very important. Next slide. So measles is transmitted by the air, like I talked about. Young children, infants, can get very ill from this. The deaths can happen in that age group. Children under 5, they get ear infections, so it can be a cause of hearing loss, right? So this is another reason that even if you're not dying, you get ear infections, and then some of them end up with hearing loss. Pregnant women, immunocompromised people, the symptoms are usually a week or 2 after the infection. So you can spread it before you know you have it. So that's how these things really get spread. High fever, cough, runny nose. It's like a cold-like illness. But the characteristic thing is the rash. And there can be complications, pneumonia, brain infection, inflammation around the brain. And then people can die from this. And then there's a rare complication that can happen years after the infection. So you get the infection, you recover, and then there's a fatal rare complication. It occurs about 1 in 10,000 cases. But when we had many, many thousands of cases in the United States, we used to see that complication. All right, next slide. This is a rash. I've already seen a case of measles this year in a nurse who was taking care of pediatric patients. And she got exposed to somebody who wasn't vaccinated. And she was sick. She was in the hospital. Um, Very rare for me to see measles. I think that's the second or third case I've seen in my career. Next slide. All right, I'm going to leave this vaccination slide because you're going to talk about the vaccine. Next slide. So let's talk about the flu. The flu is a bad illness. If you've ever had the flu, who's had the flu? I've had it. It makes you feel bad. Makes you feel like you want to die sometimes. It's terrible. But there actually are a number of deaths from the flu, sometimes directly from the flu, and sometimes they are associated with the flu, right? So if somebody gets the flu, then they have a heart attack or they have other problems or they end up with, many organs that are failing, different things like that. And every flu season in our ICU, we have people that are on life support, that are on ECMO, um, uh, from just the flu. And some of these people sometimes are healthy. So uh, many people will tell you, I've never had the flu. So why should I get the vaccine? I've never had it. I would say it's the same reason you should wear your seatbelt. You might not have had a terrible accident, but you could have one today or tomorrow. And so, will the seatbelt prevent you from getting in the accident? No, but it might save you from getting injured. So the flu vaccine does the same thing, right? Um, so this is just an indication of how many deaths we have. And in the pandemic seasons, we can have more deaths related to flu. So up to 60,000 people in the United States, that's a lot. Okay, next slide. Confirmed deaths just purely due to flu in the 2021 season, 5,000 flu deaths, 100,000 hospitalizations, 9 million people going to the emergency room. There's a reason. You miss work, your children get sick, you have to miss work because of the children being sick. This is the reason that we recommend flu vaccine for pretty much everybody. All right, next slide. So the seasonal flu vaccine, it targets either 3 or 4 strains of flu. This year it's a trivalent. Some years it's quadrivalent. It has 4. This year it has 3. 2 types of type A and a type B. And in the Northern Hemisphere, we usually know what's going to happen with the vaccine and how successful it's going to be because it happens in the South first, and then we get it here. And so this year, it's about 50% effective. And so you're going to go, should I do that? 50%? 50% is a good number. And it means that it will prevent a lot of hospitalizations, a lot of illnesses. And so if many people are getting the flu vaccine, it will be very helpful to have this particular flu vaccine this year. But the recommendation is for everyone 6 months or older. It reduces the risk of going to the doctor by 30 to 60%. So when should you get the vaccine? Usually right now, October, early November. That's when you want to get it. It will last through the flu season if you get it, but your immunity wanes. There are 3 vaccines for people that are 65 or over that have a higher dose, and those are recommended for those people. There's a nasal spray that can work for young people. It's actually a live weakened virus that can be for some people. Okay, next slide. All right, we're going to switch gears. We're going to talk about COVID vaccines. There may be many questions about this at the end, so I can answer those later. So I think the big question for most people is, well, why should I get COVID now? Why should I get the COVID vaccine now? It seems to be a mild illness. And so I think we're kind of stuck with COVID. We're going to have it, and it's going to be like the flu. It's going to become endemic, and it has. And we still see cases. We still see cases of people in the ICU. We see people with complications, right? So recently at one of the hospitals, we saw a healthy person who had a blood clot and a stroke. No other risk factor, just COVID. So you want to prevent that, just like you want to prevent getting the flu and getting sick and missing work, or getting someone sick who has a weakened immune system. So COVID also is still a valuable vaccine to get for that reason. So generally the recommendation now is individuals 6 months and at high risk, 6 months or over and at high risk for severe outcomes. So, and that list of illnesses obesity, diabetes, high blood pressure, heart trouble, weakened immune system, age over 65, diabetes, asthma. All these things are considered high risk. So for many people, it's true. If you are completely healthy, you don't take any medicines, you see your doctor and you have a perfect health, you can talk to your doctor about whether it's, a good idea to get it or not. It still can be a good idea to get it because you don't want to miss work. You don't want to have some weird complication. You don't want to end up with long COVID. So we think that the vaccine helps prevent long COVID. If you didn't get the illness in the first place, you're less likely to get long COVID. That's one way. But we think that even the people that get the COVID after having the vaccine, they're less likely to develop the lingering symptoms. Next slide. I'm going to skip over this because I think you're going to talk about the vaccines. All right, so what about if you recently had it? You can delay getting the vaccine if you recently had it. So at least 3 months you can wait, or you can wait 6 months even, because you're going to have some immunity. It's actually better to have had it and then get vaccinated to get more of an immune response. And there may be some reasons that you might want to get the vaccine, sooner rather than later because you have a weak immune system, you're on medications, you've had cancer, you've had a transplant. Next slide. I think these slides, you're going to go over these things, so I'm gonna let you sort of discuss this. We can cover this at the end. So RSV is another vaccine. This one is a little confusing for people because there's several different categories and several different vaccines. So the RSV vaccine for older adults, there's 2 different kinds. These use traditional technology. Just like with the flu vaccine, there's a small risk of this Guillain-Barré, but generally this is a good vaccine and is long-lasting, and we think that this is going to be something that you don't have to get every year. You get it, and it protects you over the long period of time. RSV is respiratory syncytial virus. It causes a horrible cough, high fever. It's probably as common as the flu. And many years we didn't know people had it. We have better tests for it now. So it's a good vaccine to get. But it's very important in babies and children. They get sick. So if you get it in your household, you can spread it to children, especially babies. They are at high risk for this. Next slide. We'll go to the next slide. So in pregnancy, there is a new vaccine for pregnant women. And we know how this vaccine works. Thousands of pregnant women got it last year, and it's safe and it's very effective, 75 or 80%. And it decreases the likelihood that the baby will get RSV and get in the hospital. So the baby gets the immunized through the mom while she's still expecting. So it's usually given during 32, 36 weeks of pregnancy, and you can give it with other vaccines. There's some sort of discussion about whether you should get it with the pertussis vaccine or not at the same time. You might want to delay the pertussis vaccine, but generally the other vaccines are good. All right, next slide. Next slide. All right, so I'm going to cover some of these questions now. Do you want maybe we'll do this at the end? Yeah, we'll do this at the end. I'll let you talk about it. Thank you.
So Dr. Imad spoke about the epidemiology, spoke about the disease symptoms, and the general ideas about why vaccines are needed. I'm going to now shift the discussion into, sometimes people tell you there are stuff in the vaccine, there are microchip in the vaccine, there are a lot of, probably you heard a lot of conspiracy theories. So I want to spend some time to explain to you the composition of a formulation of the vaccine, and then try to convince you that it's supposed to be safe. So with the MMR, the measles, mumps, and rubella vaccine, there are 2 brand names used in the United States, approved by FDA. There's MMR2 and prior X. The MMR2 vaccine information came from the insert that's provided by the FDA to the consumers. So it's a sterile lyophilized preparation. Lyophilized means very similar to baby formula. When you get baby formula in the market, it's lyophilized milk. So when you hear the word lyophilized, mean its water has been removed to enhance its shelf life and stability. So this is a lyophilized preparation of attenuated measles virus, attenuated mumps virus, and attenuated rubella virus. Attenuated mean weakened virus. Each dose contains sorbitol, sucrose, hydrolyzed gelatin, recombinant human albumin, fetal bovine serum, and buffer. All these ingredients, we typically use them in pharmaceutical drug manufacturing as safe ingredients to improve the stability of proteins in a lyophilized form. Because lyophilization process, basically we expose the protein to very low temperature and very low pressure. And these conditions, protein can break apart. To protect them, we use certain materials like sorbitol or sucrose. Sucrose is sugar, the one we use to make sweet tea and sweet coffee. Hydrolyzed gelatin is highly pure gelatin. And then recombinant human albumin. This is a human albumin that has been synthesized to match the human albumin, the protein that is natural in the body. And then serum and buffer. So these are natural, well-known, well-studied materials that are used to make a vaccine. And then no preservatives. They don't add any preservative because this is designed to be single-use, lyophilized. When the patient needs the vaccine, the nurse or the caretaker will add water, very sterile water, and then will prepare the vaccine for injection. And this, of course, can be given intramuscular through the muscle or subcutaneous under the skin. With the flu vaccine, there are several types of flu vaccine. And in order to grow the flu vaccine, we need an incubator. So here I'm listing different types of incubators that have been used to grow the virus that's used to fight the flu. So the FDA basically approved what's called the egg-based flu vaccine. We're using chicken egg, and then we introduce the virus into the egg, and the virus begin to grow inside the egg. Then we extract the virus from the egg, and then we either kill or weaken the virus, and then we put it into a single vial for human consumption. So with the egg-based vaccine, manufacturing is used for inactivated or killed vaccine. This is called the flu shot that's given by injection, or live attenuated weakened vaccine, usually called the nasal spray, where we administer the flu vaccine through the nose. Also, we use what's called cell culture basic flu vaccine, where we use mammalian cells. These could be coming from sheep or goat cells, and the virus basically infect those cells, and we use them to grow the virus. Then we extract the virus, and then we put it into individual cells. There's what's called the recombinant flu vaccine. This is where we extract the genetic materials of the vaccine. It's not the vaccine itself, but we synthesize the genetic information of the vaccine, and we use it to make the vaccine. This is one example that was administered right now at Walgreens. If you go to Walgreens, you'll get Florex. Florex has no preservatives. It has the weakened virus. It also has Triton X100, which is a surface active agent used to improve the stability of the weakened or attenuated virus. Then we have what's called alpha tocopherol hydrogen succinate, which is a derivative of vitamin E. All of us use vitamin E. And here you ask why they use vitamin E. The reason they use a derivative of vitamin E, I use the word adjuvant. Adjuvant, we use the word adjuvant in vaccine because we want to increase the ability of the human body to produce antibodies. So here we're using vitamin E to increase, or derivative vitamin E, to increase or encourage the body, particularly in people age 65 and above. Their immunity may go down. So in addition to the weakened virus, we use these adjuvants to increase their immune response. So they produce high level of antibodies to enhance their protection. And then polysorbate 80 is a synthetic surfactant. Now, with COVID, there are different types of COVID. If you see here in the middle, these are the different companies that came up during COVID epidemic and produced the COVID vaccine. Now, with COVID, some of these technology using a dead or inactive virus. Some will use a virus that has been genetically modified. So they change the genetic information in the virus. So cannot induce the disease, but can induce an immune response and create antibodies to protect the person. Or they produce or use a protein, which is part of the virus itself, and make it enter the body to make an immune response, or use a synthesized DNA, which is genetic information, that can make the protein of the virus itself in the body. So we're not producing a virus in the body, we're only producing part of the virus that can instigate the body or encourage the body to make antibodies against it. And then we have the latest or technology with messenger RNA, similar to what Dr. Imad mentioned. You're providing the therapy to the cell in the body, and you're instructing the cell, I want you to make a protein that's very similar to the protein on the surface of the virus. So the cell will take that mRNA, it's going to go to the body, enter the cell, and then begin to produce exactly the same protein that sits on the surface of the virus. And the body begins to fight it back. So we're not inducing the actual disease, we are just producing a part of the virus so the body can go and fight it. Now, I like this slide because there's a lot of science into this slide. When people made the mRNA that you see here in the middle, if you introduce the mRNA into the body will get rid of it. It will not be able to enter the cell. Another technology was developed to get this mRNA into the cell. This technology is using what's called solid lipid nanoparticles. These are lipid materials. The mRNA sits in the middle, as you can see here, and we're using lipids. Some of these lipids are natural lipids. Some of it are synthesized lipids, considered to be safe, and it's like a vehicle. Once this lipid gets to the cell will think it's another cell, and immediately it's going to take it inside. Once it takes it inside, it's going to release the mRNA inside the cell. Without this unique delivery, the mRNA will not be able to be effective. So there are a lot of science, there are a lot of advancement into making these delivery systems to get the protein of the virus into the cell. And once this mRNA is introduced, now it gets to the cell will make the protein required, then it's going to secrete that protein. The protein now, the B cells and the T cells that we discussed, part of the immune system, will begin to secrete antibodies, and these antibodies bind on the surface, and once they bind on the surface, if the virus, for example, comes in, these antibodies sits on the protein of a virus, and as you can see here, it prevents the virus from getting into the cell. So if a virus comes to the body, these antibodies immediately sits on the surface of the virus and prevent it from going to the cell. Particularly many patients with COVID, many patients, they get the infection, the virus sits in the lungs. And there's a specific receptor in the lungs that attract the virus. So with the vaccine, that entry into the lung is blocked. So the virus will not be able to bind to the specific receptor on the surface of the lung and doesn't get to the lungs. Now with RSV, here I bring multiple examples of RSV vaccines. This is the vial of the vaccine. It's actually 2 vials in a one. The upper is you have the diluent, which basically water with other ingredients, and then the lower chamber has the lyophilized, weakened, or part of the protein of a virus that sits in the lower chamber. So when the patient want to take the vaccine, the nurse pushes the top cap, and then the liquid falls into the lower compartments and dissolve the vaccine. And then with the needle, you get the vaccine and you administer to the patient. Now with this vaccine, there's RSV-A and RSV-B. So you have what's called the P protein, the F protein. And then if you look at the other ingredients, mannitol, sucrose, sugar, polysorbate 80 is surfactant, and other salts. So there's nothing abnormal about the formulation that can make people worry. This is another RSV, but made by JSK. You have the F protein for the RSV virus, and you have also what's called the adjuvant system that can boost the immune response. If we look at the combination, we have saponin, which is a material extracted from a specific plant called Molina plant. So it comes from natural resource. Then we have another lipid mixed with another synthetic lipid and cholesterol to make a lipid system that can get the protein into the cell. So most of these ingredients are natural or synthetic, well studied, and safe to be used, and they enhance the penetration of the vaccine into and then if we look at the other ingredients for this vaccine, we have sodium chloride, which is salt that we typically consume. You have potassium phosphate and disodium phosphate to make a buffer, and then surfactant, etc., and no preservatives. So the notion that there are materials can harm you in vaccine is typically nonsense. These vaccines have been well studied, and there's a lot of science that went into development of these vaccines. So I'm going to stop here and shift to microphone to Dr. Imad.
I think mostly I just wanted to address questions, so maybe we can open up the floor in a minute, but I'll address some of the common questions. And I think Brother Hassan talked about this. He talked about preservatives. There was a big controversy about something called thimerosal, right? And people were worried that this preservative caused autism. And it's been studied extensively in many, many millions of patients, and it doesn't do that. Thimerosal is a preservative, and it's ethyl mercury. And there's a toxic form of mercury called methyl mercury that if you eat a lot of fish, you're getting it in your diet more than you will get from a vaccine. This is not that form. This is a different form that doesn't cause problems. There was a study by a doctor in England. His name is Wakefield. And he did this study and said that this MMR vaccine causes autism. that study was debunked. The study included, you know how many patients it included? Does anybody know? 12. 12 patients. And when they looked, some of the patients had autism ahead of time. Some of them didn't have autism. They were all provided to the doctor by attorneys who were trying to sue the vaccine company. And the doctor got paid a lot of money because he was invested in another company that was going to come up with another vaccine. So he lost his license. The study was retracted. But anyway, the damage was done, and people started believing that autism is caused by this vaccine. But after that, not 12, not 1,200, not 12,000, not 120,000, millions of patients were looked at, and there's no evidence of autism. So that was put to rest. I think one other question that I get asked all the time is, they said, Doctor, it seems that people that got the vaccine are getting the illness more often than people who didn't get the vaccine. How can that happen? I was asked that question a lot during COVID. And the answer is math, right? It's mathematics. Let's say we have an illness, it's very contagious, and you have 10 people, they're not vaccinated. And I have 600 people that are vaccinated, right? The vaccine is very effective, 98% effective. The 10 people that didn't get vaccinated, they're exposed, all 10 of them get it. With measles, that would happen. Measles is so contagious, that would happen. Measles vaccine is also, if you get 2 shots, 98% effective. So of those 600, Sean, how many people, if 2%? 12, right? 12. 12 will have it. So now we have 12 people that they're sick, they got vaccinated, and only 10 that didn't. That's out. When you have so many people getting vaccinated, you're going to have more people that were vaccinated with the illness than unvaccinated people. That's the reason we saw that. Does that make sense? That make that clear? Okay. I think sometimes people also ask, well, why is it that you get the vaccine and you still get sick? Why is that? I didn't think that was supposed to happen. And it's like the seatbelt analogy. The people will hopefully get less sick. They will get less symptoms if they're vaccinated. So what the vaccine does is it helps your body fight the illness faster and more effectively, but it may not completely prevent the illness. In some cases, there are some vaccines where it completely prevents the illness and you don't get it. And many other vaccines over many years, this is not new, polio, for instance, or with measles, or with they're not 100% effective. So, but I don't know if people have questions about vaccines. Sometimes there are questions, so I'll open it up for any kind of questions that people have. Yeah, so I think I talked about that before. Do we really need a COVID vaccine every year? Yeah, it's like the flu. So yeah, it probably is a good idea to get the immunity wanes. So it probably is a good idea. Thankfully, we are not seeing horrible cases and all the deaths that we were seeing before. But is it still a good idea? Yeah, we still think it's a good idea for people to get the vaccine because it's going to prevent you from getting sick, maybe prevent you from getting in the hospital because of it or having some other complication or long COVID. Yeah, you can. And it's totally fine to do that. That's another question that many people have and a common myth is that we are overloading the immune system by giving too many vaccines, right? You hear this complaint where people think, oh, we give children too many vaccines. Why do we do that? We do that for a couple of reasons. One, children, babies are at high risk, and you need to vaccinate them when they're at the highest risk of having a problem. So if you wait and you give them one vaccine, then another vaccine, then another vaccine, you put them at risk. You also increase the cost. They have to go to the doctor so many times. They have to get so many shots. So it is perfectly safe, and it has been studied. There are a number of studies that have looked at giving a number of vaccines, and it's fine. There was a study where someone estimated you could give 10,000 vaccines, it'd be okay. Just think about it. A new baby is exposed to all kinds of things, thousands of new things all the time that their immune system is handling. So we're giving these controlled chemicals that we've studied, and we've also studied them together. So sometimes that's a myth too, is that people say, oh, well, they weren't studied together. No, they were. That's been looked at.
Jazakumullah khair. What other questions are there? I don't see any sisters up there, so I guess they're not listening.
Assalamu alaikum, Jazakallah khair, brothers. On the mRNA, since we have the traditional synthesizations of the vaccines, a dead, semi-alive protein, what was the driving force to come with an mRNA messenger vaccine? Was there a call for it scientifically from disease control, or is it corporate America business?
I like this question. If you remember when COVID hit by the end of 2020, about December 2020, and then the vaccine was given to physicians, nurses by February of 2021. People said, where did this come from? Why the vaccine came so quickly? There must be something wrong to develop a vaccine in 2-3 months. Well, the story of this mRNA started in the 80s in Pennsylvania, University of Pennsylvania. And 2 years ago, Nobel Prize went to the two people who developed the mRNA in the 80s. So the mRNA has been studied in the last 25 years to combat cancer. And people were studying the mRNA to fight cancer, and there were clinical studies going. When COVID hit, BioNTech, the company that teamed up with Pfizer, the Turkish brother and his wife, they were working on mRNA and cancer. Immediately shifted to making an mRNA after the Chinese scientists published the information about the S protein on the surface of the COVID vaccine. Once that information became public, immediately every company started looking at making the mRNA because the expertise and the development has matured in the last 25 years. And the beauty of this technique is there's no virus, there's no dead virus. We're only using the genetic information that can make a specific part of the virus, which is the surface protein on the virus. I hope I answered the question.
I'll just add to that one other thing. There was another illness. So this illness is called SARS-CoV-2. There was a previous SARS, and it was initially very scary. When that infection happened, we learned a lot of things about these coronaviruses, particularly that one. And we learned that the body makes antibodies against the spike protein. So when a new coronavirus came, and there was another coronavirus, MERS, that happened in the Middle East, right? Same thing. It was a coronavirus, and it had this same kind of idea that this was the target. So they knew when we get another coronavirus causing an epidemic or a pandemic, the target has to be the spike protein. So as soon as the Chinese published this, they knew this is the part of the virus we need to attack. So that we had a head start because we'd had an illness like this before.
Jazakallah khair. Any other questions? We have one here.
Assalamu alaikum. So the question is, when the mRNA is instructed to create the protein, it's still something that is net new to the body. So is that a risk when you're introducing something in the body that is not naturally there? So you're basically manufacturing something. Did I understand this correctly? You're manufacturing this protein in the body to be able to give the body the ability to fight. So that introduction of a new element in the body, is that a problem?
So, I mean, it's like any other medication that you put in your body, right? This is a protein. We know exactly what it is. So, this is a recipe. The mRNA basically goes inside the cell. It's in the outside, it's outside the nucleus. There was also this misnomers that it changes the genetic information of the human. It doesn't do that. It's outside, and the mRNA simply instructs which proteins to make. Then these proteins go to the surface of the cell and basically allows the body to make antibodies. And this looks just like what happens when the virus attacks, but the virus doesn't just assemble this one piece, it assembles new virus. This can't do that, right? So it's simply a small piece that does not cause illness, right? We also studied the safety of this vaccine, and there's lots of misinformation about that, but you know, there were like 1 billion doses given for this vaccine. So if there were problems, we'd be seeing that, and we're not seeing that. So and you would see it very quickly, and we didn't see that. So I think that anytime a vaccine is, sort of marketed, studied, they're looking for harm. There was another vaccine, the Janssen vaccine, early on, and it had problems and it caused side effects. And so that vaccine was withdrawn.
So basically, with the protein, as Dr. Imad mentioned, I mean, the protein, the cell make the protein, and then the protein sits on the surface of the cell, so the antibodies basically can bind to it. But then the protein in the body gets eliminated, doesn't stay. So there's no fear of this protein going other places or creating anything. So there's none of that because the body gets rid of it. So it's just a tool to make the antibodies.
Final call for questions? Nope. All right.
Assalamu alaikum. Thank you so much for doing this, and jazakumullah khair. Question number one, two questions. I'm greedy. Um, you spoke about the SARS viruses and the family of COVID. Is the viruses evolving, or is just a virus from another family, or, and forgive me if I sound obnoxious, or the virus is being immune, so it has to change as a tactic and evolve? That's the question number one. Number two is, with vaccination, you gain your body introduced to the virus. With the illness, you gain probably the whole entire form of the virus. So when do you see the benefit getting vaccinated if you're already able to handle the actual virus?
Great questions, both of those. Let me address your second question first. I think if you didn't hear him, his question was, what about natural immunity versus vaccine immunity? That's basically what your question is, that wouldn't it be better to get immune from the illness itself rather than just, some vaccine, which is part of the virus, not the whole thing? And so I think the problem is that you run the risk of getting the illness, right? Which you don't with the vaccine, right? So that's one issue. The other issue is that there are many vaccines that elicit a better immune response than the illness. There are some where that's not the case, where the illness elicits a better immune response than the vaccine. But we can have a specific sort of immune response when we're doing the vaccine. We know what it's going to be. It's not going to be uncontrolled because we can study it. And if it's uncontrolled, then we don't use that vaccine. So, so that I think that's the answer to your second question. Your first question was about SARS, and I'm trying to understand exactly what you're asking. You're asking whether these viruses arise spontaneously. Do they evolve? Yeah. So so, I mean, that's a complicated question, but the answer is yes. These viruses can change, and they can change depending on what population they're in. We see in real time there are different variants of COVID. That's evolution. Sometimes viruses evolve and they become more contagious. Sometimes they evolve and they become more deadly. And sometimes the other way around, right? And it can go back and forth. There's a very famous experiment that was conducted in Australia. So, Australia is an interesting place. They don't have a lot of predators. So, what happened was the people that came to Australia, they introduced rabbits, English rabbit, and they devastated the countryside because there was nothing to eat the rabbits. And they ate all the crops. And so, before long, there was like 150 million rabbits in Australia, and they didn't know what to do. And they said, "Oh, you can hunt them, you can do whatever," and they couldn't get rid of the rabbits. But they knew that these rabbits were very similar to rabbits in South America. And in South America, those rabbits get an illness, and it's a virus. It's a sarcoma virus that causes cancer. So they took that virus and they introduced it into the rabbits in Australia. Within 1 year, 99.99% of the rabbits died. But then something funny happened. There were more rabbits. And now they didn't die from the virus. They were resistant to the virus, the rabbits. It just selected for the rabbits had evolved. So now when you took the virus that they had gotten from South America and gave it to these new Australian rabbits, they wouldn't die. They'd get sick. They'd form these tumors, but they wouldn't die. But here's the other interesting thing. When they took the virus that was circulating now in these rabbits in Australia and they gave it to the rabbits in South America, the South American rabbits didn't die. The virus evolved and the rabbits evolved. Actually, that is going back and forth now. and we're having this interest. So yes, viruses can evolve. They can become more deadly. They become less deadly. Sometimes we encounter these viruses in the animal kingdom and they can cause illness. They get into people. They're, actually HIV. That's how we think that happened. It started in monkeys, and people were eating the monkeys. They were eating bush meat, and somebody got a cut on their hand and got in contaminated blood and got this monkey virus, and then eventually it spread to people.
On the issue of the variants, to be more specific on what changes happen to the virus. For example, in the case of the SARS virus, the changes in the surface of the protein can happen to a change in the amino acid sequence. The change in the amino acid sequence create the variants that we talked about. So the antibodies doesn't bind as strongly to the protein anymore. So we need to modify the mRNA so it can fit to the changes that happens to the protein. And that's what creates the variation in the virus.
And that immune escape happens in the body too. So that's why you had COVID this year, and next year you could get it again because the virus has changed, and you get immune escape.
Okay, I think we'll conclude. Jazakumullah khair for sticking with us. Jazakumullah khair to our wonderful doctors who presented us with such valuable information. I wish more people would have stuck around to listen to it because As you know, in our community, conspiracy theories abound and people don't go based on facts sometimes, but we have the facts right here, mashallah. So, jazakumullah khair. May Allah reward you for your efforts. We'll conclude. Jazakumullah khair for staying around. Subhanakallahumma wa bihamdik. Nashhadu an la ilaha illa anta nastaghfiruka wa natubu ilayk. والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين وآخر دعوانا عن الحمد لله رب العالمين السلام عليكم ورحمة الله وبركاته